I'm going to tell you what I am not. I'm a dermatologist, so as with most dermatologists, I spend most of my time telling people about the dangers of sun exposure, as Julian hinted at. I'm not a psychologist, I'm not a psychiatrist, I don't treat seasonal affective disorder or mood disorders, and I don't have special expertise in that area. But I do have a special interest in the effects of sunlight on the skin, that's photodermatology, abnormal reactions of the skin to sunlight, and somewhat paradoxically, the use of ultraviolet light, which can be dangerous, but the use of ultraviolet light therapeutically and visible light to treat skin conditions. And these are treatments known as phototherapy and photodynamic therapy. So, sun is necessary for life on Earth. But what is sun? Sun is the electromagnetic spectrum. And we mainly think, I can't get the pointer to work, what am I doing wrong?
No, it doesn't work.
Oh, it doesn't work, okay. So what we think of it of is the visible spectrum here, the bit in the middle. But there are other rays involved, ranging from the very low frequency, very high energy rays here, gamma rays and X-rays, which don't reach us on Earth, which is fortunate because they're dangerous. Then we go into the ultraviolet spectrum, which I'm going to talk more of in a moment, then the visible spectrum, and then on the other side of the visible spectrum, we have infrared, beyond red, and infrared is heat. And then beyond that, we have radio waves and microwaves and so forth. So let us concentrate first on ultraviolet radiation. And it's arbitrarily divided into UVC, UVB, and UVA. And you know when you look at your sun cream bottle that it'll say UVB and UVA on it. And what does that mean? UVC doesn't reach us, it's attenuated by the ozone layer. So we're not going to talk about that. UVB is 300 to 320 nanometers. There's much more of it around because it's quite easily attenuated. So there's much more of it around in the middle of the day, and there's less of it around in the winter when the tilt of the Earth is away from the sun in the northern hemisphere. It is biologically very active. It's a mutagen, it mutates DNA and is responsible for skin cancer. UVA is longer wavelength, and that is more penetrative. So it's harder to cut it out. That's why sun creams aren't so good at cutting out UVA. And there's much more of it around at the beginning of the day and at the end of the day when there's less UVB. And UVA doesn't burn you as easily. It tans you before it burns you. And that's why we burn less at the beginning of the day and the end of the day. So what does ultraviolet light do to our skin? We know it can burn us. We all know it can age us. And anyone who's gone anywhere near a dermatologist knows that it can promote skin cancer. But there are also other effects which you may know a little less about. I hinted on the therapeutic use of ultraviolet, and that works because ultraviolet light suppresses the immune system in our skin, and it's anti-proliferative, and that's helpful in dealing with skin conditions such as psoriasis. Tanning isn't a good thing. I'm not telling you to go out there and get a tan, because a tan is a response to DNA damage. But once we tan, it's protective. So it's a very good sun cream. Vitamin D synthesis is a positive effect that we're going to talk more on in a moment. Sunlight is good for our hearts, particularly UVA. Again, more later. And it has a well-being effect, mediated possibly through vitamin D and opioid release, although this is an area where there has been remarkably little research. Therapeutic use of ultraviolet. This is phototherapy, for those of you who haven't come across it. So it's use of ultraviolet light, rather paradoxically, to help certain skin conditions. And these tubes contain a phosphor, and when you put electricity through the phosphor, it emits. And depending on the tubes you've chosen, the phosphor you've got, it emits in different wavelengths, and we tailor that to skin disease. It is, you don't stick anybody in a machine. That's why you have people like me. It has to be, you have to select your patients carefully, and you have to do very careful dosimetry. So I'm not telling you to go out and do machines in the high street where you don't know what's in them and there's no dosimetry and they're not calibrated. And here is a machine in use for treating a patient, a long list of conditions that respond to phototherapy. And we can tailor it to specific areas. This is a hand and foot machine here. So let us move on to what we are all interested in today as advocates of well-being. And vitamin D. It is converted to its active form in the skin in the presence of UVB. So it's UVB, not UVA. So it's midday sun. And paradoxically, those are the rays which I've told you are the most damaging. But UV exposure increases vitamin D levels. There are vitamin D receptors present in our brain. Vitamin D is a fat-soluble vitamin. It penetrates into our brains. It affects neurotransmitter release. This is not an area of particular expertise for me because I'm a dermatologist, but it is therefore certainly highly conceivable that it plays a role in mental illness. And there is evidence, it's not well studied, for a beneficial effect of vitamin D in depression. Now, caveat here that you don't have to get your vitamin D from sunshine. You do get it from sunshine, and sunshine is helpful because it doesn't allow you to take too much, because you stop converting it into its active form in the skin when you've got enough. There's a sort of auto-calibration system there. But you can also take it by mouth, and you mustn't take too much because too much vitamin D is not good for you. Now, what about opioid release? Again, UVB, the most carcinogenic part of the UV spectrum, causes release of the feel-good peptides, beta endorphins. And there's been very interesting work in mice showing that you can make your mouse addicted to ultraviolet. And when you take your mouse away from the ultraviolet, your mouse gets withdrawal. What of our hearts? We've spoken about UVB, now we're talking about UVA. I have a colleague called Professor Richard Weller, who's in Scotland, who's always telling us that we're giving out the wrong messages. He's at the moment not the mainstream in dermatology, but he's there. And he's done work showing that UVA radiation causes release of nitric oxide into our blood, and it lowers our blood pressure. And this is independent of the vitamin D effect. So UVA has a cardiovascular protective effect. And the question is, does the cardiovascular protective effect of sunlight outweigh its carcinogenic effect? And like everything in life, it's going to be about getting the right balance. Moving on now from ultraviolet to visible light. And visible light is used for treatment. You can buy blue light machines to help acne. Now, how that works is that the bacteria on our skin produce porphyrins, and these porphyrins are activated by visible light, That's why sunlight helps acne as well. And there's an inflammatory response, and that zaps your spot. So it's a zap spotter. It's not particularly effective. You're not going to clear significant acne with blue light, but it can be a helpful adjunct treatment. But what you can do is apply these porphyrins in a very expensive cream onto the skin, and then, after it's sunk in, expose the skin to visible light. And this is so-called photodynamic therapy, and it's helpful in treating certain forms of skin damage and skin cancers. So it's a very complicated area, isn't it? Good things and bad things. There is no doubt that overexposure to sun, particularly midday sun, is harmful. But it's not one size fits all. The risk is related to the individual. It's related to your skin type, your skin colour, whether you've got red hair or darker skin. It's related to your genetics, whether you're on any other medication. So it's tailor-made. And we know our where we sit on this spectrum generally. There is also no doubt that tanning is unhealthy behaviour, and seeking a tan is unhealthy, and it's associated with body image concerns, and it can be addictive. But on the other hand, there is now solid evidence that sun exposure, independent of physical outdoor activity, so outdoor activity is good for us, but the beneficial effect of sun seems to be independent of the exercise effect. And it's beneficial for health through the cardiovascular effects and probably also stress reduction. And this appears to be mediated by vitamin D, nitric oxide, and beta endorphins, but there may be other mediators we don't know about. So the paradox that as physicians and as advocates of health we face is, what is safe sun exposure? And the message is nuanced. It has to be personalized for each one of us. And I wish to conclude by saying it's all about balance, like everything in life. And with the words of Talleyrand, above all, do not be overzealous, either in too little or in too much. Thank you for listening.